We have continuing coverage of Aspirus Keweenaw nurses' efforts to get Aspirus management to rescind changes that are giving workers more patients to care for. Today, nurses held a rally to inform the community about this situation. TV6 Houghton Hancock Bureau reporter Colin Jackson tells us what the nurses had to say and Aspirus' response.
Over 20 Aspirus Keweenaw nurses and supporters held a rally this evening, calling for safer staffing at the hospital. This comes after changes that require individual nurses to care for more patients.
We had prior arrangements that were made between nursing staff and management. Extensive research was undergone to make a collaborative decision on the prior numbers that were being used, and those were working really well. Management, for reasons that were never actually explained to us, have changed those numbers.
According to the nurses, a nurse cared for 3 to 4 patients a shift before the change. Now they have to take care of 5 to 6 patients. Today's rally aimed to encourage Aspirus to rescind the changes and inform the community about what is happening. Aspirus provided a statement to TV6 regarding this. Aspirus has a threefold commitment to our patients, our people, and our communities. As such, we respect the right of all employees to rally. However, in this case, the nurses seem to be protesting against something their colleagues had a hand in structuring. As our staff nurses were engaged throughout the process, I asked Helpy for her thoughts on this.
Thoughts were collected and completely ignored, so we didn't have any impact on the current numbers that are being used. We told them that it would decrease the quality of care and reduce the ability to provide safe care.
Aspirus adds that the changes were put in place in late March and have been both appropriate and effective. Registered nurses on the medical surgical care unit have served 4 patients or fewer per shift 81% of the time and 5 patients 19% of the time. At no time over this period has any nurse been assigned 6 or more patients. In short, we have implemented an appropriate, effective staffing model that allows our valued care team to continue serving patients with excellence and compassion. I also asked Helpy about this. She says she believes the data is incorrect due to frequent staffing changes.
Some newer staffing numbers have been brought out this week to be trialed by management. So the numbers don't always make sense, and shift to shift, I really doubt that they could keep track of the percentages.
The nurses are also asking Aspirus to recruit more nurses and keep the nurses they have. We will continue to update you on this story as it develops. Colin Jackson, TV6 News,